guest, Dr. Alissa Kuizinas. We're going to talk about hidden causes of foot pain. Be with us till the end. And if you have any issues or any problem with your food, please join us and ask your question. Wow, I'm so excited talking to you today, Alissa. And this is the first time after more than 200 episodes we are going to talk about foot pain. I know I'm so happy we found another doctor that who believes in holistic medicine and but the foot pain she's gonna go through the whole deep causes of this problem. Thank you so much for being here. I'd like you to have a little bio about yourself, and then we're gonna have some questions.
Awesome. Well, thank you so much for having me. This is very exciting to be here. So my name is Alissa. I am a podiatrist. I'm a foot and ankle surgeon, and I am very interested in the holistic and sort of natural side of podiatry and foot issues. So really happy to be here to kind of talk about that because I think there's a lot of interesting stuff that people can learn that, may not be obvious and that we can really use to help our bodies.
Thank you so much, Alissa. So tell me about your story. What happened to you that you actually turned your belief to holistic medicine?
Yeah, so I was trained, in a very traditional setting and really kind of relied for many years on kind of surgery and things like orthotics and injections and medication. But I actually had a foot problem myself, and that's what really kind of started my transition away from all of those things because I really wanted to find a solution for me that wasn't, something very invasive. So that's really how everything started, and it really inspired me to kind of look outside of the box a little bit and see, what else are we missing as sort of a profession. And I started to discover a lot of really cool stuff, not only about our feet, but about bodies in general. And I started to really transform the way that I practiced around that. So that was kind of the turning point for me and how I got here.
Alissa, I know in acupuncture, all the points in food are so important because every part of the food related to one of part of our internal body, like heart or even kidneys, and it's so amazing, right?
It really is. Yeah,
whenever
it's incredible.
I feel cold, like in my food, I try to cover it with socks because I know that's the way that you waste your energy. I love to know about this more in depth when I have you right now.
Yeah, absolutely. So totally very interesting. There's so much more interconnectedness, I think, between, different parts of our body than we normally think. And so, yeah, with our feet, that's a great example, right? Having these points that we can use. I think another big one that people underestimate is our connection to the ground and to the earth through our feet. Our feet are actually they're actually supposed to be used as a sensor, kind of like our eyes, and they're going to help us really sense our environment and really navigate the world. So when we have our shoes on all the time and when we're kind of closing off that connection, we actually lose a lot of sensory input to our bodies. And that can lead to health problems even outside of things related to our feet. So a really cool thing to do is to start to kind of return that connection between your feet. And you might find that just by feeling the ground and, feeling where your feet are in space, you actually can, help your whole body and kind of sometimes help with some medical issues that you may have otherwise too, which is very cool.
So how do you connect other parts of the body to food? How do you know that somebody come to you has maybe heart issues or kidney issues?
Yeah. So for me, there's a lot of ways that you can look at it. And my focus, at least right now, has a lot to do with sort of full body posture. And so meaning the way that not just our feet, but our entire bodies are positioned, the way that our muscles are sitting, the way that our skeletons are sitting. And this actually has a lot to do with our internal organs. So depending on what position, your body is in, your organs inside are affected as well. And so this is a really interesting connection that we can look at. And so somebody may come in with a foot pain, and we can actually look at that and kind of track that all the way up the body and say, the positioning of your pelvis might be causing it, or something really musculoskeletal. But then we can also link that to, are you having issues with any of your organs, right? Are you having issues breathing? A lot of times breathing issues can come from that. Even things that may seem very unrelated, like vision or, things going on in the neck and head, can also be very related to our feet. So there's so many ways that it can happen. But I think if we can look at each person from sort of a postural perspective, which is what I like to do, we can actually sometimes kind of solve a lot of these little problems along the way. So I usually look at kind of foot pain as like a symptom, and then it's kind of a symptom of something greater that's going on throughout the body.
So do you go to different functional lab, or what do you do to just realize this person has other issues too?
Yeah, I actually don't, but that's a great point. And that's definitely something that is helpful. So I usually will, if I suspect that, maybe refer somebody out to somebody who does really functional lab testing, because that's a great thing to do. But for me, it's more, how can we assess sort of the skeletal system, musculoskeletally, and then make sure that we optimize that so that everything else going on is really enhanced. And so that's kind of where my role comes in. And then I work, with other practitioners who can do the functional medicine component as well, because that's really, really cool that we can kind of link that all together. But I'm super into kind of the postural side, the strength side, looking at how our body imbalances are affecting things.
Give me some case studies of your work. Let's say a specific issue that your patient came to you and you solved it.
Yeah, so I would say that a pretty common one is, something that we all hear about a lot is something called plantar fasciitis or heel pain. Almost everybody has probably either experienced that or knows somebody that's experienced it. And traditionally, it's treated in a very kind of local specific way. So we might recommend, anti-inflammatories or like insoles and things like that. But if we take that a little bit further, and I've done this with a lot of patients, and really look at what is causing that sort of above their feet, usually we can pinpoint that into something with their pelvic alignment, their hip alignment, the way that they're walking and breathing together. And so a lot of times I'll kind of trace it back to these types of issues. We'll go ahead and work on those things, right? We'll actually reposition parts of the body. We'll work on strength in certain areas. And then in doing that, we're going to obviously aim to heal the heel pain or get rid of the heel pain. But at the same time, patients will come in with, different little things that have gotten better, things that they didn't even anticipate. So it could be something where maybe they had some like pressure in their abdomen, or maybe they had some kind of like GI dysfunction that has gotten better, or different things like that. It really can vary, and there's all kinds of different, things that I've seen, but that's a really cool one, because that's something that we could take and just kind of treat very simply and locally, or we could really use it as kind of a tool guide. So that's one that I really like, because heel pain is just so common, and that can really just kind of indicate something much greater going on.
Does weight affect foot pain as well?
Yeah, absolutely. So depending on, the body weight, that can cause shifts in the way that we are positioned, and it can actually cause increased pressure to certain areas of our feet. So it's definitely one that kind of contributes to foot pain. And I think it's good to take a look at, and it's good to use that as a guide to, how has my body positioning changed because of, maybe this change in weight or whatever it is. And so again, that's something that we can really look at, and we can make progress with that by changing small things about the way that we stand, the way that we walk, the way that we sit. All these kinds of things really can go a long way.
All right, so tell me about your own website. I have it here. It's scrolling here.
Yes.
Dr.
Yes,
A
Dr. Ark.
or Dr. Art. Yeah, interesting.
Yes.
What do you do there?
Yeah.
Yeah.
Yeah, so through my website, I have a blog. So I usually will try to, write on topics that are interesting to people, and most of the common questions that I get, I'll, answer in a little bit longer format. I also do virtual consults. So through my website, you can book a session with me, and then I also have a membership. So I have a membership that is sort of a functional foot membership, meaning kind of teaching you from the ground up and incorporating the rest of the body and how we can really optimize our feet in order to, not just make our feet better, but to really help the rest of our body as well along the way. So those are the three big things that I do pretty much through my website, but a lot of education there if you have questions.
Do you have any recommendation for posture to just avoid this foot pain?
Yeah, absolutely. So a couple of things that I would recommend. So number one is, keep in mind the kinds of shoes that you're wearing. So shoes are a big thing that can really throw us off balance. So many times we're wearing shoes that are either really elevating us, they're pulling our heels up higher, they're really squishing our toes together. And this has a major cumulative effect throughout our lives. So many people have just been wearing shoes that have really been throwing their bodies off for so long. So really looking at your shoes, I recommend, considering more what we call natural footwear, which is shoes that are a bit flatter. So kind of getting rid of those elevations that we see really commonly, shoes that are actually more foot shaped, right? So we have shoes that are shaped more like a wider toe box shape than the traditional kind of narrow shape that we see for most shoes. And these kind of small little things have a huge impact on our feet and then the rest of our body. So that's number one. And then number two is really to think about what positions we're getting into on a regular basis. So for most of us, it's going to be sitting, right? We're sitting in a desk all day, in a chair, in our cars. And when we're sitting like that, we're going to experience a lot of tendency for our body to want to be in that seated position, right? So we're going to get tight in certain areas and we're going to feel like we can't maybe stand up super straight afterwards. So another good thing to kind of keep in mind is that if you do have to sit a lot, to do some exercises and some mobilizations afterwards and beforehand to really extend and loosen the muscles that get really tight. So this tends to be the front sort of part of the body, the front of the hips, the pelvis, that area, and just kind of thinking about the positioning that we're in and trying to change our position frequently so that we're not just kind of stuck in one position all the time.
Great. We had a little bit disconnectivity, but that's fine. We have to. Yeah. Oh, those are really great recommendations. Thank you so much. And you talk about something, walking in nature, right? Without any food.
Yeah. Yes, absolutely. Yeah. So this is great for a couple of reasons. Number one, it's great to just.
Sorry.
Yeah. Yes, it's great to just be out of your shoes, right? And to kind of let your feet reacclimate to their normal and kind of their natural alignment. But the other benefit is that we get this what's called grounding. So we actually can benefit from the electrons on the surface of the earth, and our body can use that to fight inflammation, and that can cause a whole host of benefits for you. So if you feel like you never really get that connection with the ground, it's great to just, like, as much as you can, just go outside even for 5 or 10 minutes, take your shoes off, walk on the grass, walk on the beach. It's actually very great for your health and again, for the health of your feet. So something really great to do. That's
what my daughter likes. She likes to walk in a beach, on the beach. Sands. She loves sands.
Yes, that's a great one. I love that. Yeah, it's so good for you.
So any other recommendation or any other program you're going to promote here? You're going to talk about it? Any other workshop? Please let us know.
Yeah, definitely. So, I think my biggest recommendation is just to, think about exploring your body. If you are experiencing pain, rather than feeling like I need to find a cure for this pain, I think it's great to look at it as sort of an invitation to, take a look at what's going on in your body. And it can be a little bit of an exploration to see exactly where the problem stems from. But it's really rewarding when you do kind of figure that out, and you can again, you can kind of fix one small thing and you might have this cascade of benefit come out of it. So, for me, again, I have my virtual program, but I do one-on-one sessions with clients, and it's just very cool and interesting what we can discover even virtually. So you may just be feeling some pain in your foot, your leg, your hip, whatever it may be, but we can kind of trace it back to what that real origin is. And so I think that's a really great way to start looking at pain versus maybe feeling like it's just very detrimental and you just have to kind of squash it by taking medication or something like that.
Thank you so much. Do you have any other recommendation about the diet, food we are taking?
Yeah, so definitely, diet is important. I think, one thing that we experience a lot of in feet and lower legs is inflammation. And so thinking about our diet from an inflammatory perspective can really help as well when we're dealing with these musculoskeletal problems. So, I always encourage people to, try, of course, to stay on that sort of anti-inflammatory type diet, which is really helpful. Another one that I feel like links closely with diet is sleep. And there's a lot of evidence that not getting the right amount of sleep or the right quality of sleep can really contribute to pain that we experience, particularly in our feet. So yeah, diet and sleep really kind of closely linked with, how well we're going to feel in our bodies, and particularly our limbs and our feet. So yeah, that would be my recommendation, really thinking about inflammation, because that's something that can really get caught up in our soft tissues.
Thank you so much, Alissa, for being here. Hopefully we can have you in other summits and other shows here.
Awesome. Thank you so much.
Please subscribe to Ponta Transition channel and order my book, The Gap, in Amazon. Thank you for watching.